My name is Jing, and I graduated in the year of 2012. And before coming to Duke-NUS, I was working in the US as a research technician. I'm currently in an internal medicine residency program with SingHealth. And I think in deciding what residency to pursue was a real no-brainer for me. I mean, I love everything about internal med. All the rotations which I truly enjoyed and was inspired by were all either subspecialties of internal medicine or something related to internal medicine. So all along, I haven't had too many other ideas as to what my specialty would be after I graduated. I guess being a very new program, we all have our apprehensions about residency. We weren't really sure about what the program entailed, how competitive it would be. It's a nationwide program. We'd be applying with students from all over, not just the Yong Lin School of Medicine in our school, but also some foreign grads who will be applying for residency. So being unsure of how competitive the field would be, we were all a little bit apprehensive about what our chances would be. So I was very pleased when I heard my match results because I was very excited about starting a career in internal medicine. In some ways it's been quite similar, and in some ways it's been totally different. The similar thing is, I guess education goes on, and every day we're still learning. It's maybe not as structured as when we were a student, and in some ways you're more responsible for your own learning, but we still get a lot of tutorials and there's still a lot of teachings on a weekly basis. And in some ways, I feel more motivated to learn more because now everything that I read has a direct impact on the patients I'm taking care of. From a perspective of being of Duke-NUS being affiliated with SingHealth, I think that has helped us a lot because as a student we've become familiarized with the structures that are in place in the hospital just across the street. We've gotten used to just the medical database system, some of the workflow, and as a student we get to observe how a team works. And now that we're part of a team, we can see it all pieced together quite nicely from a perspective of inside and outside. So I think that helps overall. So Duke-NUS prepared me quite well for my residency, I would say. I would say that a lot of that depends on how many people in your class or in your year are interested in the different residencies. So to increase your chances, you should probably go for things that are less competitive or not as popular with the rest of your classmates. But you will also be filling a need that the country has in terms of medical specialties. But in terms of how to pick one, I'd say you have to choose your electives wisely in second year and fourth year. Get exposure to all the different disciplines that you're really interested in, especially the postings before the match process, because that's a valuable time for you to get to know what you really like and what you don't. I don't think it'd be all that different. I think in some ways med school has prepared me for my residency, but I think residency will prepare me very well for the rest of my medical career. And whether I'm in training or out of training, I think the learning will continue. So I don't think there'll be much of a difference after my residency as when I'm in it or before it. Yeah. I don't think I feel any different. As compared to being a Duke-NUS student, I'd say maybe older and wiser, hopefully a little bit more mature. But I think Duke-NUS is a very new thing, and there are very few of us. And I'd like to see more of us graduate so that we have more of an identity as Duke-NUS alumni in the years to come. Yeah. I think my advice for applying to Duke-NUS is similar for anyone applying to any medical school anywhere. My advice would be applying to medical school can be difficult, and it is a pretty stringent criteria to get in. But you have to take it in your stride because it'll just be the first of many obstacles to come. So you can see that as your first trial in a way. And if at first you don't succeed, you have to keep trying. And this perseverance will put you in good stead in your future career as a doctor.